Plate 14, renal tuberculosis. Figure 1, early renal tuberculosis. Uppermost papillae ulcerated, pelvis already much contracted, ureter only slightly involved. Figure 2, complete caseation of kidney, pelvis, and ureter. Nephrectomy to relieve bladder symptoms due to drag of shortened ureter. Figure 87, renal tuberculosis. Upper pole, a mass of tuberculous tissue. Lower pole, pyonephrotic. Pelvis obliterated. Figure 88, renal tuberculosis. Abscesses throughout, but chiefly at poles. Fibrolipomatous and suppurating perinephritis. Ureter obliterated. Figure 89, renal tuberculosis. Abscesses at upper T and lower poles with renal tissue R between. Pelvis obliterated, ureter thickened and dilated. Plate 15, renal tuberculosis. Figure 1, beginning tuberculous hydronephrosis. Ureter obliterated, parenchyma destroyed by ulceration, pelvis dilating. Figure 2, terminal stage. Kidney caseous, atrophied, sclerotic. Capsule stripped back, extensively tuberculous. Ureter much thickened. Figure 90, renal tuberculosis, terminal stage. Large cheesy focus above, ulcerating and sclerotic lesions elsewhere. Pelvis obliterated, ureter thick. Figure 91, renal tuberculosis. Complete destruction by sclerosis. Yet the only symptom had been hematuria, twice in 6 years, from the ulcerated papilla at lower pole. Figure 92, renal tuberculosis. Upper half of kidney cystic and caseous, yet ureter spared. Symptoms wholly toxic, digestive. Treated for years as dyspeptic. Figure 93, renal tuberculosis. Remission of symptoms 3 years. Note obliteration of pelvis adjacent to old lesion. Negative guinea pig. Then recurrence of bladder symptoms. Diagnosis by figure 94. Figure 94, pyelogram of figure 93. Cystic lower pole shows well. Also obliteration of lower half of pelvis and deformity of upper half. Figure 95, pyelogram of figure 96. Irregular pelvis. Tuberculous ulcerations in parenchyma filled with Koller-Gall. Plate 16, radiography of renal tuberculosis and hydronephrosis. Figure 1, hydronephrosis, not a pyelogram. The gross specimen removed after pyelography is shown in figure 39. Figure 2, caseous renal tuberculosis, not a pyelogram. Figure 96, renal tuberculosis and gonorrhea after pyelography. Only gonococci had been obtained from this kidney until after pyelography. Then acid-fast bacilli were found. Figure 39. Damage done by pyelography, page 98. Figure 39, damage done by pyelography. Koller-Gall infiltration of parenchyma of hydronephrotic kidney removed 2 days after injection.